Hi, Ingrid.
Hi.
We had a few questions this month from staff. The first one has to do with our CBRU moving to that low acuity ICU, and if other staff are, if it's a possibility for them to cross-train to take care of those patients.
Yeah, so I'll give you a little more background on what that plan is, and then we'll answer that question. So starting in early April, education will be coming out to kind of make sure that everybody's aware of that plan, and we'll update our placement grid. But essentially the goal here is that, we've had a countermeasure for several months where we're able to overflow our low acuity ICU patients into the CBRU to create sort of a alternative care area when we have more ICU patients than we have space for. What we've found is that has been a really valuable process, and the countermeasure was staffed with ICU nurses that were then being floated to the CBRU. Our goal was always to upskill our CBRU nurses to have that skill set. They did similar activities during COVID. It was a huge staff satisfier and actually something that helped with recruitment. So it's better for the patients, better for the staff, prevents room turnovers, things like that. So that's something that we're trying to bring back in a more formal way. So all of the nurses in CBRU have been upskilled to that low acuity ICU competency. And anybody is welcome to cross-train to that. We'll still be floating typical competent MSI nurses to CBRU because it won't be the whole unit. It's a max of 10 patients out of their 25 rooms. But if folks are interested, they certainly can get the skill set and become competent and cross-train to that. You do have to have the competency, obviously, to staff those low acuity ICU patients, but that is kind of what the plan is. And I know the CBRU nurses are looking forward to that happening and trialing it and getting it all started, and have worked really hard to get those competencies. So yeah, should be early April.
Cool. We also know that there are a million changes happening all the time, and we've heard some chatter about some unit huddles to help with that. Can you talk a little bit about that?
Yeah, so this is something that has been on my priority list since I joined 3 years ago. Lots of units have tier 1 or unit huddles, and the information flows up to our 9 a.m. safety huddle each day, which is more for the entire entity. And the information doesn't always flow back down. Everybody does it a little bit differently. It's not always a standard. And so what we're really aiming to do this year is to standardize that process, that flow, and to help facilitate that information, both for escalations going up to 9 a.m. huddle and then information coming back down. We've also noted that information is coming from a variety of different sources. We have news brief, we have, unit newsletters, we have just a variety of different things. And so this is a way to help consolidate and make sure that if you've been, off for a few days and you're coming back in, how do I know that I have what I need for this particular shift that's in front of me? And how do I have a clear understanding of what my unit needs for this day, and how I can best support and show teamwork for those situations that have arisen or that we're aware of and I've identified are higher for workload. So starting early March, we have a couple of units kind of trialing and refining that process. And then we have several more clinical areas that will be going live around the end of March. And then we'll slowly begin looping in all different units. Huddle boards will be physical huddle boards that will be populated. Information again will flow. And the aim is to have everybody to have a unit huddle by the end of the year, and that information standardly comes up and then comes back down.
All right. Our last question we got, perhaps the most important. Do you prefer pancakes or waffles?
Oh, I do prefer both, but I think if I was having to choose, my favorite pancake is a blueberry lemon ricotta pancake. So that
Fancy.
Wins. If I have that choice, I will always choose that.
There you have it. All right, ask your questions in the Ask Ingrid.
Thanks, guys.